Good afternoon, everyone. My name is McLean Bearhopt. I'm the Associate Executive Director at the network and want to thank everyone for joining us today. We've been having about a handful now of network shops available to our members across various of topics. And today we're going to be focusing on COVID-19 vaccines and the vaccination process. Wanted to mention, for those of you who have colleagues that weren't able to make it today, we're going to be offering the same presentation again on February 5th at 1 o'clock. So I believe we'll be putting the registration link in the chat at some point over the next hour. So feel free to share with your colleagues and spread the word. We're very honored today to be joined by Dr. William Fisher, who is the Deputy Director for Vaccine Coordination at the New York City Department of Health and Mental Hygiene. He's been helping spearhead the vaccine distribution in the city and has been just an amazing resource to the network and to our members as we're navigating this new landscape for our tenants and staff. So huge shout out to Dr. Fisher for all of his help along the way. I appreciate his time today immensely. He will be doing a presentation first today. It will cover what vaccines are, vaccine equity, development and monitoring of vaccines, and then of course, specifically around COVID-19 vaccine distribution. After his presentation, we'll be able to open it up for questions. So please, during the presentation, feel free to type in any questions that you have in the Q&A. And after the presentation, he will be available to go through many of those questions. We'll try to get through as many as possible. So with that, I will hand it over to Dr. Fisher, and thanks again to everyone for joining.
So I'm going to talk about where we are now, what are vaccines, vaccine development and monitoring, COVID-19, specifically COVID-19 vaccines, distribution, and getting vaccinated. So where are we right now? A little background. We all know that COVID-19 is spread by a coronavirus that first appeared in December of 2019. It spread mainly through respiratory droplets that enter the air when people cough, sneeze, talk, sing, or breathe. Symptoms appear generally 2 to 14 days after exposure to the virus, and usually include fever, cough, shortness of breath, loss of taste, smell, headache, and sore throat. And some people have no symptoms at all, but can still spread the virus. We know there have been inequities in this pandemic. More Black and Latino people have been sick, hospitalized, and died from COVID than other racial and ethnic groups. These differences in health outcomes are due to long-term structural racism, including policies and discriminatory practices that prevent communities of color from accessing vital resources, and loss of opportunity that negatively affects their overall health and well-being. The disproportionate impact of COVID-19 on New Yorkers of color highlights how these inequities negatively influence health outcomes in general. Our approach at DOHMH is that equity is central to our COVID response. We must earn trust, we must build confidence, and deliver community-focused information and programming. Community involvement and partnerships are key. We will take action to address health and social inequities that have been amplified by COVID-19, and will provide facts and information that people need to make informed decisions about vaccination. Here's where we are in our vaccination campaign. New York has reserved about 1.1 million doses. It has received about 1 million, and it has administered about over 500,000 470,000 first doses and about 70,000 second doses. It's important to note that we are in a very significant situation with this pandemic, that after the lull over the summer, we are clearly in a second wave, and that some neighborhoods are harder hit than others. The basic things we do to prevent the spread of COVID have not changed. That is, stay home if you're sick, keep 6 feet away from other people, wear a face covering, keep your hands clean by washing or using hand sanitizer, and get tested. So let's talk about vaccines specifically. Vaccines help the body develop immunity, which is protection from a disease, so that the body can help defend against that disease if it's exposed. There are many different types of vaccines. Vaccines work by preventing people from getting symptoms or complications from a disease, or preventing them from getting the disease in the first place. Vaccines save lives. Not only do they help protect the people who get the vaccine, they protect the people around them, possibly entire communities. No vaccine works 100% of the time, and some people can't be vaccinated because of a medical condition or because the vaccine hasn't been approved for some groups, such as children. This is why it's important for as many people as possible to get vaccinated to slow the spread of the virus. The key messages we want to communicate about COVID vaccines are they are safe and effective. They're available to New Yorkers at no cost. They're available to people of all immigration status. And for those of you who are familiar with the public charge rule, vaccination is not a public benefit under the public charge rule. When people are vaccinated, their privacy will be protected. Development of the vaccine alone doesn't prevent the disease. People getting vaccinated prevents the disease and saves lives. Now, in terms of how are these vaccines developed and how are they monitored? So the clinical trials involved in the development of a vaccine are in 4 phases. Phase 1 is usually a small trial, less than 100 people. Phase 2 is bigger with several hundred people. Phase 3, these are the big trials with thousands and thousands of people. And then after a vaccine is authorized or approved, there are phase 4 trials to look at what is happening in the long run. All of these trials are designed to determine 2 things. Does it work and is it safe? Vaccines have to be authorized by the Food and Drug Administration, the FDA, before they can be used. The FDA monitors vaccine development from beginning to end. It analyzes clinical trial data to decide whether to allow the vaccine to be used, and it continues to monitor vaccine safety even after the vaccine is approved. In an emergency like this pandemic, the FDA may allow vaccines to be used before they are officially licensed by issuing what's called an emergency use authorization, or EUA, so they can be used right away. No shortcuts, and this is important, no shortcuts in the testing of the vaccines are allowed. All vaccines issued in EUA go through the same clinical trials as all other vaccines. And an EUA can only be issued if the benefits clearly outweigh the risks. A number of federal agencies, in addition to the FDA, also monitor safety and efficacy during trials, and I'm not going to list them all here, but they're listed on the slide. And providers are required to report certain adverse events that may be related to the vaccine through the Vaccine Adverse Reporting System, or VAERS. Now let's talk specifically about COVID-19 vaccines. In designing these vaccines, scientists have built on many years of research, including research on vaccines for other coronaviruses, such as SARS. The federal government provided special funding, this is Operation Warp Speed, to allow development, testing, and production to happen all at the same time. That way, companies could start manufacturing the vaccine so that they would have a supply already if the EUA was issued. Normally, a vaccine manufacturer will wait to see if its vaccine is authorized, then start ramping up production. And that would have added many months to vaccine availability. There are two vaccines, as you probably know so far, that have been authorized and are available in New York: the Pfizer-BioNTech mRNA vaccine and the Moderna mRNA vaccine. There are a number of other vaccines in various stages, including Johnson & Johnson, the Oxford AstraZeneca, Novavax, and Sanofi GlaxoSmithKline. But only these two right now are approved in the US. So what's an mRNA vaccine? We keep hearing about mRNA vaccines. So mRNA is messenger RNA. COVID-19 vaccines do not contain do not contain the actual virus. They contain a small piece of genetic material from the virus that produces some of the virus's proteins. They do not contain the full virus genome or in any way allow the virus to be produced or replicate in the body. Here's how they work. The mRNA enters the body with instructions on how to make a protein that is part of the virus that causes COVID-19. The proteins then that are made trigger the body to make antibodies. The mRNA is broken down and destroyed by the body. But you now have these antibodies and other kinds of immunity to the COVID-19 virus, so that if you're later exposed, the body is able to react swiftly and powerfully to recognize and produce antibodies to fight the virus. A good way to think about it is as if there's an email sent to your immune system, and the email has instructions about what the virus looks like and how to kill it, and then the email gets deleted permanently. mRNA does not affect or interact with your own DNA. The two vaccines have been shown to be safe and effective across all genders, ages, races, and ethnicities in which they were tested. Both vaccines prevent sickness or severe COVID-19 in over 94% of study volunteers, which is a very high effectiveness rate for a vaccine. Each vaccine requires 2 doses. Each vaccine can have some mild to moderate side effects. Each vaccine was approved in large phase 3 trials, 44,000 for Pfizer and 30,000 for Moderna. And most importantly, these trials contain significant proportions of people of color, so that we know that the vaccine had equal safety and efficacy in people of color that it did in white people. The Pfizer vaccine's approved for people 16 and older, and the Moderna 18 and older. What we still don't know about these vaccines is how long the protection will last, whether additional doses or boosters may be needed in the future, whether the vaccine is safe and effective for children, and that's just because the studies have not been completed in children, whether being vaccinated can prevent someone from still spreading the virus to other people, and what other vaccines may be available in the coming months and how effective they might be. Now I'm going to talk about vaccine distribution. Who is being offered vaccine right now? New York State determines how groups are prioritized for vaccination and the timeline based on CDC guidance. People at increased risk of getting COVID-19 or at increased risk of severe COVID illness are being prioritized. People who are currently eligible are healthcare workers, people 65 and older, Residents and staff in nursing homes, homeless shelters, and certain other group living facilities such as congregate housing, both licensed and unlicensed. Certain frontline essential workers such as first responders, teachers, school staff, transit workers, and grocery store workers. Other groups that will be prioritized in the future will be additional essential workers and people with certain underlying medical conditions. This phased distribution will take time, and we don't expect vaccines to be widely available to the public until mid-2021, at which point then we won't have to worry about priority groups. There'll be enough vaccine for everyone. If you visit our website, you can see what the most current list of eligible groups and some more detail on each group. It's very important that we ensure equitable access to vaccines. We want to ensure that vaccine sites are opened in communities most impacted by COVID-19. We want to ensure that New York City communities receive clear and up-to-date information and resources in languages spoken in those communities. We want to partner with community-based organizations, clinical partners, and community leaders to listen and respond to community concerns and input, to speak openly about what we don't know, and to monitor data and community feedback to identify needs and gaps. Getting vaccinated. It's important to remember that there are a lot of benefits of this vaccine. There is very strong evidence that these vaccines are safe and effective. They protect you from COVID-19, which can have serious health consequences. And it's important to remember, whatever your age, people of all ages have been hospitalized and died from this virus. And some people have lingering health problems if they get the virus, even if they're no longer sick. It may help protect the people around you, and it helps us move closer to ending this pandemic. At this point, children less than 16 years of age cannot be vaccinated, but studies have started in this group. For some groups, such as pregnant or breastfeeding people, there is very limited information about safety and effectiveness. These groups can still choose to be vaccinated. We recommend that if you're in one of these groups, you speak with your healthcare provider. Where can people get vaccinated? They can get vaccinated at work if they work in a healthcare setting. They can get vaccinated at city-run sites or hubs or pods that are temporarily have been opened, temporarily closed, awaiting more vaccine, and will be reopened again at various healthcare facilities and pharmacies and other sites using the New York City vaccine finder to find a site near you. Before you're getting vaccinated, 1, make sure you're in an eligible group. 2, schedule an appointment. 3, complete the New York State vaccine form. 4, get vaccinated. Be sure to bring proof of eligibility and wear a face covering, and make an appointment for your second dose. The vaccine finder is very simple. You can type in an address or zip code, and it will bring up a map showing vaccine locations near you and links to their scheduling programs. The second dose is very important. The first dose does provide some protection, but protection increases greatly after the second dose. The second dose should be the same type of vaccine as your first. For instance, if you start with Pfizer, your second dose should be Pfizer. And the vaccine reaches full effectiveness 1 to 2 weeks after the second dose. The second dose should be scheduled at least 21 days after the first for Pfizer and at least 28 days after the first for Moderna. You will also get a proof of vaccination card, which you can bring when you have your second shot. Side effects. Most people report side effects from vaccines. These are usually normal signs that your body is building up protection. The most common side effects are soreness or swelling on the arm where you got the shot, headache, body aches, and tiredness. You may also have a fever. Side effects are usually mild to moderate. They start days of getting the shot, usually the day after, and usually last for about 1 or 2 days. They're more common after the second shot and less common in older adults. If you get side effects that concern you or do not go away quickly, or if the redness or soreness where you got the shot increases, call your healthcare provider. You may also talk to your provider about taking an over-the-counter medicine, such as Tylenol or Advil, to relieve pain or discomfort. Even if you have these mild or moderate side effects, it's very important to get the second shot, unless your healthcare provider tells you not to. Allergic reactions are something you may have read about. They are very uncommon. But if you've ever had an allergic reaction to a vaccine or an injection, then you should talk to your healthcare provider. Other types of allergies, such as food, pets, dust, pollen, latex, are not a concern for this vaccination. Allergic reactions usually start within minutes to an hour of getting the shot. They may include difficulty breathing, swelling of your face and throat, a fast heartbeat, a bad rash all over your body, dizziness, and weakness. If you think you're having a severe allergic reaction, call 911 or go to the nearest hospital. After vaccination, you have to continue to take the precautions that we call the core 4. Stay home if you're sick. Stay at least 6 feet away from others. Wear a face covering when outside your home. Wash your hands often. Why is this? Well, like all vaccines, COVID vaccines, even though they're very effective, are not 100% effective. So there's still a small chance you may not be protected. And we still need to learn more about how long the protection lasts and the impact on disease transmission. We will, of course, let you know if and when we can ease these prevention measures, as I'm sure we're all very eager to get back to things as they were. It's important, as we said, to practice prevention, to take care of your mental health, and to amplify these messages. If you know someone who's been vaccinated, if you got vaccinated, share your story. It really helps if someone you know hears from you that you got vaccinated. And that's it for me. I'm happy to take any questions.
Sorry, I also need to unmute. Thank you so much for a great presentation. It answered many questions that I've had over the last several months. And I think, I was kind of just perusing the questions as they were coming in. I think what I'll do is just sort of go from the top and go down and see if you're able to answer any of these questions that our members are having.
I will do my best.
The first question we have relates to this whole issue around, the availability of the vaccine. So, someone actually got the first shot, looks like, mid-January, but now is being told that there's no second dose available within that 28 time frame period. So now they're having to book 39 days out at a different location than when they went. So frustrating, yeah. I would imagine. So could you?
Very frustrating. Yeah, sure. So first, the science, the 28 days is a floor, not a ceiling. So you should wait at least 28 days. The CDC just revised its guidance to say that 28 to 42 days is a perfectly fine interval. There were a lot of glitches in the rollout of these vaccinations, and a lot of glitches, mostly in the sort of IT technology for booking appointments and so on and so forth. However, the state has reserved, there is still a second dose reserved for everyone who got a first dose. Second doses are not being repurposed at this point as first doses. So everyone should be eventually able to get the second dose, and it really is not going to affect the efficacy if you don't get it right on day 28. But I do apologize for the inconvenience. I know when the pods or hubs reopen, hopefully later next week, they will have a much more sophisticated appointment system, and second dose appointment should be able to be made right on the spot after your first dose.
Great. Okay, thank you. Another question, are people who are vaccinated still able to transmit the virus to others, even though they're protected themselves?
We don't know yet. And that's one of the reasons we encourage people to keep doing the masking and the social distancing even after they're vaccinated. The trials that approved the vaccine looked at people getting sick more than whether they were carrying the virus. But as studies continue, we should know that. And once we know that, we'll have a lot, better information to go on.
Yeah. And for those who have compromised immune systems, should they be vaccinated, or are there concerns around that?
I would suggest discussing it with your healthcare provider. This is not a live virus vaccine, so there should be no concern about the vaccine giving you COVID, but in terms of how your body responds and so on, probably best to discuss with your healthcare providers. But immune compromise is not a contraindication to this vaccine.
Okay. Have there been any discussions at the city around methods of reporting? Like if someone does have a severe reaction after the second dose or months after being vaccinated, is there a reporting mechanism?
So everybody, at least who's getting vaccinated at the city sites, is given the opportunity to sign up for the vaccine adverse event reporting system app, which allows you to report any kind of adverse reaction you may have had.
Okay, great. Also curious if the city has looked at what percentage of Black individuals have died from COVID. Is this something that the city or the state is tracking and aware of?
Yes, we have, and it is disproportionate to the percentage of Black people in the population. Black people have gotten sick, been hospitalized, and died disproportionately from this illness.
If a person has already gotten COVID-19, they were positive, should they still be getting vaccinated? And is there any time frames around that?
We do recommend that you still get vaccinated. This is because we believe the vaccine gives more robust immunity than just having had the disease. People should wait at least until they are out of their quarantine or isolation before getting vaccinated, and can feel free to wait up to 90 days after they've either been sick or tested positive.
Okay. And I know I personally have been knee deep in this question, but could you speak a little bit to who exactly is eligible at supportive housing organizations for the vaccine? Is it just the front, like case managers, security staff, supers, or is it also the admin staff that might not be interfacing with tenants every day directly?
The guidance is for people, and this applies to every healthcare setting, not just supported housing. It applies just as well to a clinic or anything else. it's people who have direct contact with clients or the public. So an administrator who works in an office separate from the facility or in a corner, doesn't normally come into contact, would not be eligible. On the other hand, a receptionist would be eligible.
Great, thank you. Could you speak a little bit, like what would be your advice for people speaking to staff and tenants and colleagues and neighbors, that people are concerned about side effects and that the vaccine was developed quickly? Is there any advice on how to respond to that or how to help people become comfortable with this?
Yeah, this is, of course, a question on people's mind. I think the first thing is a trusted messenger. In other words, a staff who speaks to staff, a resident who speaks to residents, it can be great. The vaccine the timeline was quick, but it did go through huge clinical trials. 44,000 for Pfizer and 30,000 for Moderna, and most importantly, significant representation of people of color in those trials, and no difference in safety and efficacy between people of color and white people in those trials. So I think all we can do is the facts and our personal experience. So I've gotten the first dose. My arm was really sore. It's not going to stop me from getting the second dose.
Yeah, and to that point, what if you do have side effects after the first one? Is it recommended that you should still get the second? Or
unless you have a severe allergic reaction, it is recommended that you get the second dose. Remember, side effects are really typical with vaccines. A lot of vaccines give you side effects. They're mostly a sign that they're working, that your body is producing immunity. So if you have a headache, fever, you just feel icky for a day or two, that's not a reason not to get the second dose. If someone had a severe allergic reaction, they should absolutely discuss with their healthcare provider whether they should get the second dose.
Mm-hmm. And on again, the timing of this is a more specific question, but if you test positive for COVID just a few weeks before your appointment is set for the vaccine, should you still go forward or should you wait the 90 days until after?
You can, anytime after your 10-day quarantine period is fine to get the vaccine.
If you have antibodies for COVID, will this impact the vaccine?
There is right now, the only antibody related contraindication to delay the vaccine is people who have gotten monoclonal antibody therapy for COVID, which is usually done with people who have severe illness and are hospitalized. Mm-hmm. Those people are advised to wait 90 days before getting the vaccine.
Okay. And what about women who are planning to get pregnant?
There has been
advice around that?
There's been a lot of unsubstantiated stuff in the media about this vaccine having some effect on future fertility. There has not been a single solid piece of science to support that idea. So I would say that, there's no, it's an understandable fear, but there's no scientific basis for it.
Mm-hmm, mm-hmm. Okay, I think we answered these. So we have someone who works in an affordable senior housing. with Chinese and Spanish speakers. Many residents are deciding not to get vaccinated yet because they're older, like 70 to 90 years old, have asthma, diabetes, high blood pressure. Are any of those legitimate concerns? And can you speak more to the side effects that appear in older adults?
Those are great reasons to get vaccinated as soon as possible. As you know, the state first rolled in 75 and over and then 65 and over. Older people are more likely to develop severe complications if they get COVID. They're more likely to die if they get COVID. People with underlying medical conditions like high blood pressure, like respiratory disease, are more likely to die if they get COVID. So this is a population that really urgently should be vaccinated. In terms of side effects, in general, side effects are less in older adults than they are in younger adults.
Okay.
Side effects from the vaccine.
Right, right. So we have another question about the process here. We have someone who works in a congregate care facility. Staff and the residents are eligible in phase 1A. They've been trying to get appointments for the tenants through the hotline, but they're refusing to schedule for under 65, even though that's not specified in the eligibility. Any thoughts on what is going on there or advice on how to?
That is, whoever said that on the hotline is obviously misinformed. We're at DOHMH trying to partner folks with vaccine providers like FQHCs and so on to try to sort of get people vaccinated in group vaccine events. But please, that person can email me with the specifics, and because clearly the staff and the consumers in that setting are eligible. There's no reason they shouldn't be given appointments.
And yeah, and I think maybe Joelle, could we put also Dr. Fisher's email maybe in the chat? I know he's been great. Also feel free to feed them to myself as well. And we can help coordinate, questions going forward with the city and state officials as well. There are a lot of questions around just, do you, Dr. Fisher, have any sense of, there's been a backlog of the availability of the vaccine, not just here, but across the country. Any sense of like how that might flow going forward? I think a lot of folks are showing up and they're being told at the clinics that, there aren't vaccines available right now, even though they fit into those two categories for prioritization. Any thoughts on that or knowledge on that?
We're hoping that the flow will get better enough that at least we can reopen the 15 city hubs at late next week, and anybody who had an appointment for the days that they closed down was automatically given an appointment for next week. We also have to see, we have a new federal administration, and we'll have to see if they're able to boost vaccine production. But that's going to be a critical piece of the infrastructure. Obviously, we can't vaccinate people if we don't have sufficient vaccine.
Yeah. Can you give examples of acceptable documentation for supportive housing tenants or staff? Do they need any documentation?
Yeah, a letter, the safest thing is to have documentation, and a letter from the sponsoring agency or program manager is perfectly fine. You could even, come up with a form letter where you just insert the name, is so-and-so is a resident of congregate supportive housing,
Okay.
At this program, and that should be all you need.
And if someone lives, for example, in New Jersey, can they still apply for the vaccination in New York?
If they work in New York, they can. If they
Okay.
don't either live or work in New York City, they're not eligible to get vaccinated in New York City.
Okay. Another specific health question, is it safe for someone with chronic asthma to get the vaccine?
Chronic asthma is not a contraindication to the vaccine. If you have any concerns, you should discuss it with your healthcare provider.
Yeah. This is an interesting question. If you contracted COVID, but you received the vaccine while positive, does the vaccine help in fighting it off?
Probably not, because the vaccine takes 1 to 2 weeks even for the beginning of the immunity to kick in after the first dose. So you're probably over your COVID by the time the vaccine is starting to have an effect.
Okay. Getting COVID, which I believe is considered to be 90 days, last I knew, or the protection of the vaccine.
I'm sorry, could you say that again? You fuzzed out for a minute.
Yeah. Is the immunity of getting COVID, does that last longer than the protection? Like, do we know how long the vaccine protects people for, the length of time?
We don't know yet, because it just hasn't been around long enough yet. We're hoping years, but we'll have to see as the results come in. In terms of having had COVID, it's generally accepted that you probably are protected for 90 days, but nobody really knows beyond that.
Is there any difference just in the makeup of the first dose and the second? Could you speak a little bit to?
It's just 2 identical doses of the same vaccine. It's just that the immune system sort of needs 2 wake-up calls to really get busy chunking out antibodies, but they're identical.
Okay. And I thought I had read somewhere there was talk about a vaccine that would just be 1 shot. Is that actually?
That's the Johnson & Johnson vaccine, not yet approved in the US.
Okay. And is there any indication of the timeline of that? If it
will probably be considered by the FDA relatively soon. I don't know what the efficacy is, whether it has this, this 94-95% efficacy is really exceptional. So
yeah.
I don't know if the Johnson & Johnson will be as effective.
Okay. What is Regeneron, and what does that do that is different than the vaccines listed in this program?
So Regeneron, I believe, is antibodies, but I'm not familiar with it myself. If it can someone, I can Google it, but it will take just to see what the. Hang on.
It's okay. We can keep moving.
Yeah, keep
There's
moving.
So many questions to get
All
through.
right, keep moving.
And definitely, if there's questions that come up and we're not able to answer, we have the list of questions too, and we'll try to do some follow-up also for the participants on any questions that we didn't get answered today. So we could definitely do that. There was also just someone wanted to clarification again on the types of supportive housing that are eligible. Based on the guidance that they've received, only some types of supportive housing, like housing with shared bathrooms, eating facilities, are eligible. Can you speak to the differences?
Yeah, congregate housing is eligible at this point, which is usually defined as multiple people sharing at least some facilities. Used to be only licensed congregate, now it's licensed or unlicensed congregate. Scatter site apartments are not yet eligible.
Okay. Yeah, we have heard too that from the state that there was indication that scattered site would be on the list.
We heard that staff of scatter site, that is
Staff,
case
not
managers,
tenants.
but
Correct.
again, we have not been able to get the state to give us that in writing, so
Okay.
we're not officially promulgating it.
Okay, good to know. Um, on the COVID-19 form to schedule for the vaccine, it asks for a date of the first dosage. What date should be entered?
That's a good question, and I've heard that before. My gut is if you're getting your first dose, just enter the date that you're scheduled for it.
Okay.
If it's your second dose, then of course enter the date that you got the first dose.
Mm-hmm. Okay, we answered that one.
These
Um,
are great questions.
I know, I know. If we're still learning about symptoms and impact of the virus daily, how can the vaccine know what to fight or protect us against when it enters our body?
Because the vaccine doesn't protect you against the the symptoms of the, I mean, it does, but it does this by actually attacking the virus itself. It teaches your body to make antibodies and immune cells that recognize proteins on the surface of the virus and use those as signals to attack and kill the virus. So if you can kill the virus, then it can no longer cause the symptoms.
Okay. Um, you know, someone here is talking about being extremely apprehensive about getting the vaccine, particularly, you know, within the Black and Brown communities, having lack of resources and advocacy, access to information, support, et cetera. Wondering if there's any case studies or literature that proves that the vaccine is safe and effective for the Black and Brown people. If that's something that could be shared or, um,
Sure. If you go to the Centers for Disease Control, CDC website, the data from the trials of both the Pfizer and the Moderna uh, vaccines are publicly available. And again, those data, I believe it's Pfizer was 10% African American and 20% Latino, and I think Moderna was similar. Again, those studies, which are large studies in the tens of thousands of folks, showed no safety difference between Black and brown people and white people. So the numbers on this, it's totally understandable that people of color have significant distrust of both government and the medical community, given the history of misuse of uh, medicine and government abuse of people of color. It's completely understandable. However, in this case, we really do have solid numbers that show that there's the vaccine's just as safe and effective for them as it is for white people.
mhm. Um, if the second dose is the same as the first, as you know, talked about earlier, can a person go to a different provider to get the second dose if the vaccine hubs remain closed?
Yes, as long as it's the same brand. If you started with Pfizer, you should get Pfizer. If you started with Moderna, you should get Moderna.
Okay. Couple more specific questions. Doctor, if someone has a severe heart condition, is this safe? If someone has a reaction to penicillin, sulfur, can they still get the vaccine?
Yes, um, uh, the if you've had a reaction to an injection of penicillin, probably best to talk to your healthcare provider, but it's probably safe. There's nothing in the vaccine, you know, that there's no penicillin, no sulfur drug in the vaccine. A severe heart condition would be a reason to get the vaccine once people with, you know, if you're otherwise eligible. Right now, there's no eligibility in New York State for underlying medical conditions. That's not one of the eligible groups yet in New York State. But if you're, eligible because you're 65 or because you're working in supported housing or whatever, then yes, absolutely.
Yeah. And what about these new strains that we're starting to hear about of the virus? Are these vaccines also effective towards those? Do we know?
So we're pretty confident that for the British strain, the B117, which is more communicable but no more severe than the virus, that the vaccine's equally effective. It's less clear in terms of the South African strain mutation, but it still would have considerable efficacy, at least in preventing severe disease, if not all disease. So I think that the news is relatively good. The sooner we get more people vaccinated, the less virus is floating around, the less it has the opportunity to mutate and produce all these different variants.
Mm-hmm. Homeless shelters, are people eligible in shelters to be vaccinated?
In some categories of shelters, you'd have to consult with Department of Homeless Services to, I don't believe that all shelters, but I think many categories of shelters are.
Yeah, and we will at the network, we'll follow up from this presentation with an email, and we can attach also the guidelines and sort of a description of who's eligible, who isn't eligible, if that would help everyone. I know there's been a lot of back and forth on it over the last month or so. The other thing I wanted to ask, I know we're coming up to time.
I'm sure you have commitment, but I can run a little over.
Run over, okay.
Yeah.
Is DOHMH, I mean, this presentation's been amazing, and I know we're gonna do another one, as I mentioned earlier, on February 5th. And at the network, we're trying to figure out ways just to educate everyone and get this information out to our staff and tenants. Is DOHMH doing, could you talk a little bit about your roadshow and how you're approaching, just the misinformation and fear around receiving the vaccine, and just who's involved in that and anything you think we should know?
So we have a speakers bureau. We'll get these slides out to you, where they have to be converted to PDF before we can release them. But and there's a link to the speakers bureau. We also have been working very closely with community-based organizations, faith-based organizations, to really try to tailor the message to the groups that we're addressing, and to develop and recruit trusted messengers, people who are known in their community and who have, decided that they want to promote vaccine use. And, that can be much more powerful than some guy from the health department coming in and talking about it.
Yeah. If a person had COVID-19 twice because they got reinfected, is it still recommended to get vaccinated? I would
Yes.
assume, right?
Yes, it is.
This is a little different than what we've been discussing today, but I think it's equally important. If an employee has tested positive for the virus, after they've completed their quarantine time, the 10, 14 days, depending, do they need a doctor's note upon return to work? My understanding was Department of Health at the state was issuing sort of release forms, but is that happening, or is there a different process?
Well, the health department will issue a quarantine order, which will allow you to use sick time with your employer. It's really more your employer. I mean, most employers, after a certain number of days out sick, do require some kind of letter from a doctor to start work again. But I think that's more an employer specific thing than a Department of Health thing.
Okay. This is an excellent question. You had mentioned earlier around, having to continue to wear masks and do all the precautions just because it was unclear if you can pass it along if you've been vaccinated. How are scientists gauging then the long-term efficacy of the vaccine if people are still doing all those same precautions?
Well, because we know even despite those precautions, we're in a second wave of virus. We expect as vaccines get more and more widely distributed, that curve I showed you that was coming up, we expect that to
Yeah.
start coming down. It's called an epi curve, and we'll see. We'll see this second wave get stopped if we can get enough people vaccinated.
And do you know if there's a list of possible allergens that may be for the vaccine for those who have severe allergies to certain medications? Is there somewhere?
The Moderna website would, or Pfizer, if you're looking at, would contain the actual inert carriers. There's no medicine in the vaccine. It's just the mRNA and then the chemicals that are used to keep it stable. And it appears that those severe allergic reactions that have happened are reactions to some of those, chemicals that are needed to preserve the mRNA.
Someone asked, can you walk into a City MD and just get vaccinated? Or
no, every vaccine site so far is by appointment.
Okay. And how can people do that? Do they go to your?
Go to the vaccine finder on the DOHMH website. You enter your zip code. It brings up a map. You hover over a site. It'll show it. It's just like Google Maps kind of thing. And then there'll be a link. If they have an online reservation system, there'll be a link to make, or there'll be a phone number.
Okay.
So unfortunately, each type of site has its own reservation system. So the city sites have a reservation system. City MD has a separate reservation system. H&H has a separate reservation system, and that's unfortunate. So you have to do a little shopping.
Has there been any discussion around, taking the vaccine every year, like we have to take the flu vaccine? Is that sort of where you think this is going, or there been discussion?
We really don't know yet. We'll know that later on. We're hoping for at least a year, if not more,
Okay. Few more questions, and then I think we're going to wrap. I didn't realize it's almost 2:05. Very specific. If a person has COPD and kidneys state 3, is it safe to take the vaccine? Do you know the answer?
I would say consult with your healthcare professional, but kidney disease in and of itself is not a contraindication.
Okay. And then lastly, could you speak to, is there any insight you could give to us around how the prioritization has gone? I believe it's New York State Department of Health has been prioritizing for New York, correct? It's
correct. So the CDC issues sort of general guidelines of who they think should come first. Then it's up to each individual state to either implement those, or they don't even have to. They could prioritize differently. So for instance, in the CDC prioritization, 65 and over is in the same group as underlying medical conditions, but not in the New York State has prioritized 65 and over and has not yet prioritized underlying medical conditions.
Yeah. I mean, this person was asking a really important question, which is, if Black and Brown communities are disproportionately affected, why have they not been giving preference?
Well, in a sense, they have, because all of our pods, all of our vaccine hubs are located in communities that have shown these higher rates of complications. Now,
Okay.
they don't
Mhm.
have an actual preference by race, but we tried to make the vaccine availability as close to home as possible for these folks.
Yeah, yeah, absolutely. Great. Okay. Well, I think we're going to wrap here. It's 2:06, 2:07. Appreciate your time so much, Dr. Fisher. We really love working with you. And I would just offer again for folks, as you have questions, please feel free to reach out to me directly. We'll put my email in the chat as well. Happy to, we're constantly talking to the city and the state around all these types of questions and trying to feed out as much as possible. So stay in touch. We will provide this then. We did record it and we will have the presentation to provide out to our members. And again, if you'd like to join us again on February 5th or invite your colleagues, we really encourage you to do that. In addition to the Speakers Bureau, at the network, we're looking for ways to help disseminate all this information and provide space for people to ask these sorts of questions so that everyone's knowledgeable about the vaccine and feels safe in what decision they want to make around it. So thank you again so much for your time.
Thank you so much,
Dr. Fisher.
Thank you for having me.
Absolutely. And we'll see you again on the 5th.
Very good.
Have a good Friday.
You too. Bye-bye.